Hello, my good people. Welcome back to our educational channel, whereby we promise to give you educational bangers, and we are trying to keep to our promise. So, for those who have not subscribed, continue subscribing, sharing, and commenting our videos so that they may reach as many people as possible. So, let's continue with our broad topic, whereby we have been discussing about fibroids. We discussed the three types. We started with the intramural fibroids, we came to subserosal fibroids, and now we are in the last type of fibroid, which is called pedunculated fibroid. This is this type of a fibroid, as we said before, fibroids are always benign and non-cancerous. So pedunculated fibroid are benign, or in other words, they are non-cancerous growth in the uterus. So, like all types of fibroids, pedunculated fibroids develop out of the muscle of the uterus. They develop out of the muscle of the uterus. So, fibroids are typically round formation of muscle fiber. In pedunculated fibroid, the round nodule is attached to the uterus by a stem called pentacle. I want you to get this. In pedunculated fibroid, the round nodule is attached to the uterus by a stem called pentacle. Let's talk about the causes and risk factors, or the predisposing factors, all the factors that can predispose one or a lady, because this is always common to ladies. Fibroids don't attack men. So what are the causes or the risk factors to this kind of fibroid or pedunculated fibroid? So healthcare provider or healthcare providers are not sure what causes fibroids to develop, or why fibroids develop on a pentacle. So healthcare providers, or we can simply call them doctors, are not always sure what causes pedunculated fibroids to develop, or why the fibroid or the pedunculated fibroid develop on a pentacle. But it is always believed that sex hormones, for example estrogen and progesterone, play a role, since most women don't experience. I hope you get this, that healthcare providers are always not sure what causes fibroids or what causes this kind of pedunculated fibroid to grow on a stem that is called pentacle. But they always believe that sex hormones like estrogen and progesterone play a role in making this kind of a fibroid or the pedunculated fibroid to grow on that stem called the pentacle. So what are the risk factors? One, being black. Black women have a 2 to 3 times increased risk of fibroids compared to white women. Number two, being overweight or obesity is another predisposing factor, or a factor that can lead one to developing a pedunculated fibroid. Number three, having a close female relative like a mother or sister who has fibroids. This is what we call positive family history of having fibroids. This means there is a person in your family who has ever had fibroids, be it a mother or a sister. So this can predispose you into having a pedunculated fibroid. Number 4, if you have never ever having been pregnant, you have never ever got pregnant. Note this, fibroids are less common in people who have had several pregnancies. Fibroids are less common in people who have had several pregnancies, all who have been on birth control pills. And this suggests that there is a harmful factor that play in development of fibroids. Let me repeat this, and it's a point to note. Fibroids are less common in people who have had several pregnancies, all who has been on birth control pills, and this suggests that there is a hormonal factor at play in development of a fibroid. What does this mean? This simply means for a fibroid to grow, there must be a hormone involved for this fibroid to grow. What are the symptoms of pedunculated fibroid? Mostly, they don't cause symptoms, or in other words, they are asymptomatic, but for some people, they can become problematic and should see a doctor when the symptoms become problematic. So mostly they don't cause symptoms, but for some people they can become problematic and should see a doctor. So the symptoms of pedunculated fibroids worsen as the fibroids continue growing bigger and bigger. When they are small, someone may be asymptomatic or may not have any symptoms, but as they grow bigger, somebody may start experiencing pain, which brings about discomfort. Pedunculated fibroids can cause severe and noticeable symptoms than fibroids not attached by a stem. So they can cause severe and noticeable symptoms than fibroids that are not attached by a stem. Because when it's attached by a stem of the pentacle, it may be swinging, and this brings about pain and a lot of discomfort. So, pedunculated fibroids can cause severe and noticeable symptoms than fibroids not attached by a stem, because sudden movements cause the stalk to twist, causing a lot of blood supply to the fibroid, hence sudden pain or pressure. Other symptoms include 1. Frequently painful episodes as fibroids get bigger and more prone to twisting. As it is attached by a stem, with frequent movement it has to swing to make some movement. So this brings about a lot of bleeding and pain. So frequent painful episodes as the fibroids get bigger and more prone to twisting. Another one is what we call cramping or cramps, which is always obvious. We have already discussed about in other fibroids. We have pressure in the lower abdomen. We have irregular bleeding or heavy periods if fibroid is submucosal or inside the uterus. So this marks the end of this video about pedunculated fibroid, and in our next video, which will be the last part to discuss about fibroids, we will be talking about fibroid and fertility. Or does fibroid interfere with your fertility as a lady? So let's continue subscribing, sharing and liking, and Let's continue keeping the support on. Let's meet in the next video.